It's amazing how the sense of a sacrificial thing. But that doctor has other people, wants to even improve themselves. If they want to improve themselves and they want to go for courses, that's going to take money. Which facility do you know, or can you speak of, that the doctor themselves have to take it upon themselves to improve? That, see their colleagues outside, and those ones are. If you check now, how many of those that are in medical school are willing to stay in medical school right now and are not changing? How many of those that have finished medical school, it was, you have to do a profession. I told my dad, I said, you said what? That was, thank you. But that was my generation, people that were pushed into medicine, pushed us. It wasn't going to. Doctor wants to be a doctor, am I going to be able to survive Nigeria? But you can fill in the blanks.
Shaggy, let's just do that.
Okay, Shaggy. In medicine, the biggest thing I couldn't mention is care. Why are they striking? Or more.
Universities are currently on strike now, and they are just 2 months there from the university system. If yes, to how this impacts, which means that we have patients in the hospital were advised to check out of you're very critical. And so when the doctors, we need to now ask the question, those who are supposed notion that because they do not patronize the average person in one local government in water, what do you think we need to market so that they can understand?
Yeah, look at it. Get to the point. Which doctor was able to say that to a patient? Oh my God, did you see oxygen in Lagos? Somehow oxygen came out. It's not a priority with me. And you kind of wonder, if you're saying that there's no consult. So even if you change the policy, nursing officials can at least take care of the patients, then what? You don't have oxygen. You don't have, actually have to have what are going through so that they can fix the problem. If we say that I hope you know that. Right. It is going. So I don't think it's just the policy. I think, okay, in the hospital, where's the point? As in like some people just, what? Some people need to check why.
There's a seasoned multicultural internist, 25 years ago, and why she's experienced enough to speak on this subject matter. Stranded, and that sort of triggered thoughts that imagine for their own welfare. What is the reason? The policy, yes, be waivers. They wouldn't pay extra. This law has not been implemented. Reviewing their salary oftentimes takes the front burst to people cheaply. I think that it is being handled with enough political.
And I don't think it's I know someone who found in Nigeria. Well, good. There was a time when onions were. It was amazing. Come on now, straight up, most people like it because it doesn't cause the headaches and the nasty taste. And I don't even know if you can still find it now. There's only one person that said that he had a connection, and he could get it. Lagos. We made it difficult for the companies to stay. And we're notorious for doing that in our country, the pharmaceutical sector. We've got excellent scientists within this country. It's amazing. Look into that and then see how we can fund that sector to the country. Why do we look at that?
I always have. I have one in my bag right now.
Okay, so there, well-known brands, but not local brands. Now we've got local brands.
But that should usher us into another conversation. Remember that 2 years ago now, we saw they left the country and we saw the cost of medication.
60 now? 60.
As at the time.
It was 60 for inhaler.
Wow, because when that still stock at 16,000.
It was expensive.
Out of the fact that medical companies left the country and their complaint was foreign countries, and we started having to start local production. Afford it.
I make the loan friendly. Make the loan for what they ask for when you want to start. ICU bed as if it was for the person, but because it was a private, so that about. I'm trying to give a service. Help me give that service. See how many roadblocks, encourage them. We will see the growth. Put a Nigerian in a difficult situation, and Nigeria will find a solution for that situation. So I think that if we remove the roadblock, well, power supply is everybody, but if it is.
So the counter argument in the United States, even when we talk about politics, they're always referring to the United in form of insurance, so to speak. So they hardly pay out of pocket. But 90% of the cost of healthcare in Nigeria, GoFundMe, to afford 7 million. If you need to get surgery done, they just need the other countries in form of things like health are oftentimes reluctant to do the right things.
Power will not do the right thing. But I do think we need to stop. Two different things. You can't galaxy to the law. If they do not provide the service which they say, you sign the policy that's okay, fine, health policy, this and this and that and that. You go there, we no longer do all this and that, and it's not covered. You can't hold anybody accountable. And where I'm working at, I see a lot of should do. They can't do full blackouts. When they are signing, and even if you do tell them an tree. Yeah, this you cannot
now, and how there's no representation for things like that. Well, we're still talking the country years of experience in. You most likely will get to pay. Do you think exists between private and administered, and the way private?
Basically, you can quality, and you. That's how much it is you now go, and then you don't have a straight line to your caregiver. You can state that okay, fine. The time I will spend up in a public facility. In a private, whereas in a public, it can take. I must do a shout out to are in a public facility. Expectations and service are at a reduced cost and bridge the gap. Individuals that have made it. It's either the two, and two facilities on strike.
Right.
As in. Nobody was guys of private facilities. Public facilities, you don't have that choice.
Here, private, but we realize that it might on strike. They practically either you've seen situations where people with broken bones have had to amputated because they cannot afford that care. Let's talk a little now. We know that NAFDAC is doing everything Cation. So you go to and then you buy to use it, and then your situation is worse. And the situations that are pushing Nigerians.
Oh, that's a tough. They're trying their best, and Nigeria being Nigeria, you can't put on us as individuals, whereby the license and look at it, do I know the name? Or chemist, you will have a variety of drugs and have medications that are generic, and we have it. And in the outpatient departments, you and medication in. It was not prescribed. Local chemist and gotten the medication, and the chemist had told the person. I was like, what is this? I had to go and start recognizing names. Because it wasn't working, the person had now come to us, I'm not feeling fine. But see, we now dump that bag. And in a sense, our knowledge, our the person is lie to lie. Trying, and it is on us as well as professionals, healthcare professionals, try and do this. You cannot afford, then let's do more prevention. Well, then government, we really need to take responsibility on that.
These medications where there's just the health center, or that we want to create mobile clinics where where we have mobile clinics where at least they can attend. Think we will be able to.
That is an excellent idea. Wonderful ways of reaching the masses. It's a teleapp, and basically it's if you go on, you can see that you can access care, and it's quite affordable. I haven't actually seen. This is something that was innovated by a nurse. Further. Near them, okay? Schedule the visits to all the clinic on wheels and go there, but it's something that can be done. You get? So you can do it's something that, yes, it can.
Nigerians understand why there's still that reservation and that resistance to insurance. I mean, think of pension, they pay a sum, their employer pays a sum, and they're currently protesting that they don't have access to their pension. You just pay premium. And if you when they have seen other systems,
gone through different phases in the country, it does what it says it would do, but people, and then the insurance is in quotations. Then sometimes they don't pay back. We're not treating you because you're. I can't answer at this point in time. I don't know how. Even in the best insurance scheme, at something not covered, but you said that I was covered. You're not covered, and you're thinking, but because of the financial sector give care as advertised, how to spread word about something that is good. So once we have a scheme
I'm
that...
going to slowly wrap up the conversation, but we've been able to look at some of the challenges. We've spoken about insurance hesitance, the disparity that exists between the public and private public facilities, the lack of political leaders to the question to start to correct these issues. If we were to start, what are the first steps to make ladder they still have access to at least...
I'm going to talk about the private sector because that's where I've been for the past couple points are, where the cost is. So if we now say that for power, we now facilitate and help all, then that it will bring their costs down, right, in country, so that will change. I know that we will see a change. Equipment production.
Mostly long-term plans, if we're being honest, because we still had a conversation. There's no light. Everybody's using their loans, for example, as you said. Maybe considerations for how much money they have to spend in any plan for this probable healthcare can be.
Solar energy. So I don't know about. So it's a huge thing for most providers.
On that one. Well, thank you very much, ma'am. We appreciate your time on the program today, Dr. Lu. Just so people understand, strategic leadership in medical administrations in 3 continents, worked with government partnership where she consistently used operations to enhance access and outcomes in resource-constrained and what Nigerian doctors are going through. I wish you all the strength that the universe can offer to you. Thank you so much. Right. Well, that's it for the question and answer session, or should I say segment of this Just Work, coming into the hands in terms of healthcare, especially at a time when nutrition and health, your overall, the first step in a very deep rabbit hole. When we say healthcare, we're not just talking about, kidney disease or sickle cell. And mind you, the papers this morning told us that even Yaba has no electricity. How many doctors do we have in the country drawing their loved ones from hospital, pulling their loved one from the... I need to speak to what the issue is. I don't know why the name of the doctor that takes care of the... There's a name, obviously, for the doctors who take care of the bones. It will come to me. But instead of going to the stitches and jabs and pulls and strains, and then there's who are coming down with kidney disease of leaves and just... There's no proper training, and then you get too much pressure. Do we blame people? Absolutely not. But then one maker at the bus stop with a hot pot of herbs, and then there's the placebo effect where you drink it and for some your kidney is given out. There's a correlation subject matter. If you'd like to talk to us about the conversation you saw in a while, what government hospital health, people who have diabetes, for example, people who have sickle cell anemia, who have to constantly be on medication to avert a crisis. And this is just a few of the medications. I know that to join the live stream on 0410. That's the phone line. You get 000-430. That is for WhatsApp. So we do have to take care of their illness. Nigeria did not get this bad until central bank. That's not what we're talking about. Let's focus, please. Thank you for your contribution. Hello, good evening.
Hello, good evening.
Evening.
I've listened to your guest with rapt attention. I just...
Can you pose a question to me? I'll pose it to her.
Oh, no problem. I mean, instead of them, the emergency was their delayed work. So emergency situation, just because the person hasn't got a card, they will not do, maybe if it is pregnancy matter, we tell you to drop money before delivery and things like that. So, and that person may just die. So I see emergency was as delayed works. And not only that, and they don't sympathize with the patients. So these nurses are there, I don't know patients. They write a place. They tell you a lot of fake jobs in Nigeria, back and pharmacologists working together to make expensive. So I don't want to make them buy 15 naira per cassette. Now, patient for the simplest one. Well, I'm not talking of malaria drugs, and make sure that these exporters of certain drugs. Hello?
Good evening to you.
Good evening. This WG policy. Like when you say suicide, all one is outside there, they are children, their wives, Nigeria, not that to 2020.
time you want to call in, if you're listening, voice is oftentimes muffled when you call with your Bluetooth or your headphones and you're discussing this evening. Well, I did speak to my guest, but we want how much did you spend? We would love to hear that.
When my mother was sick, 1,000, remember 1,000 Moshow General Hospital. Now, since we are not satisfied, so we still go back to they are just dribbling us, go here, come this side, go here, and by God's grace and luck. So we went to that woman. Although we at one Sabbath church, one white garment church like that.
Okay, here, but we can still take phone calls. I think we have some 15 minutes. They're about to take contribution. Text message or WhatsApp. We have 0913-6000-4. That you have a health condition that sort of forces you to use medication. Every money you have to spend to maintain your health. What sort of inflating cost of medication is very germane, and I'm happy you brought it to the front for 17,000 naira 500. This is absolutely crazy. Something has to be done urgently to arrest this ugly situation. Why those in government doing plans must stop. Chris from Magodo. A conversation and experiences like this one is 091 via WhatsApp's here in Nigeria person. What part of the country are you in? How accessible? Love to get your contributions about that. And in the comment stranded, where people are ill, their big view of their salary. And was it Imo State Governor now who has improved the states who are now taking it upon themselves to pay doctors more? What the country they're being pulled into the negligence, where we see take with the prescription, where you go to the hospital for a head. What is the way out? How do we solve this? Move straight to reading the news at 5:30, and that after that we have sport. Then we wrap up the conversation, and then you can join Situation Room tomorrow at 4 p.m. 7 a.m. This conversation will most certainly continue because we would be bringing up a subject matter. We're going to go on a very brief break right now, so we can figure out what's going on with the phone line. Yes, and then we come back, take contributions, and we can